here's the little baby's head right here. And then this is the spine back here. And there's the rib cage, the stomach, baby's heart beating, and lower body. That's its bladder. This is the hip to the knee, the other hip to the knee. Well, you guys are spot on. This baby is a girl. There's absolutely nothing poking out right there at all. I'm sure you have a girl. We'll give you pictures and stuff here too. Glad you guys are doing that, because sometimes this just doesn't work well in this room. So. Baby's lower legs are coming right here, and they're crossed at the ankles there. And then here's the little bottom of the feet. There's a foot, and there's the other little foot right there. Oops. So there's one foot. And there's the bottom to the other foot. That's one side of the leg, kind of bent, so you've got the hip to the knee, lower leg, ankle, foot, and the other thigh to the knee, little lower leg, and then the foot would be there. I just can't quite get into it yet. And you can hear its heart beating here. And we're going to count that. So baby's heart rate is running about 148 beats per minute today, and that's normal. Here's a little side view of its face. Cute little profile. It's a pretty little profile of baby. This is, we're looking at the face straight on, kind of think more of a skeleton. And you've got a little hand just so moving right up there. Now baby's going to move. See its mouth open? It's a cute little picture. This right here is its tongue right there. Closed. Oh, come on, don't look down. And there's a little face with its mouth closed. We're also going to show the little nose and the lips here. So just kind of think of right here.
Oh yeah, that's cute.
So you've got the little tip of the nose, septum, nostril, upper lip, lower lip, and chin. And this baby's lip is intact. Looks really nice. This is the heart, like we're looking down inside, and since this baby's at a good spot, I'm going to go to the heart here first. So this is like we're cross-sectioning through the chest, like we're cutting the chest in half. And you can see down inside, and that's the chambers there to the heart. Really pretty pictures. So these images show us that this baby's heart has 4 chambers to it, and that's what we should have. Nice pictures. We're also going to show how the arteries come off of the heart, where those areas are at. And these are called the outflow tracts. Oh, baby, don't turn. Well, we might come back to that. Well, turn back. Baby's got an arm over that. We'll come back to the heart. So we're going to measure this baby's head, and that's one of the ways we check how old they are. This is like we're looking down inside, and all those structures are all different brain structures.
So that's from the top of the head?
Mm-hmm.
Okay.
Yeah, and we're about right now the level just above your eyebrows, because that's the widest part of your head. And we know we're there by all these brain structures that we see right there.
Mm-hmm.
So in this first 2 trimesters, everyone's baby grows at the same rate.
Mm-hmm.
So we're very accurate to do a study now and set a good baseline as to when this baby should be here. And then she'll come whenever she wants.
Mm-hmm.
She doesn't care what we tell her when she should be here. But this just sets that baseline so that if you have preterm labor, then we know how early you are, or if you're post-stage, then we know how late you are too.
Okay.
And if baby's growth patterns down the road are okay. And then it's that 3rd trimester that they grow according to their size, what they're going to be.
Okay.
And we're going to just show different brain structures here. So this right here is the back portion of the brain, the cerebellum. We always like to see that.
That's cool.
It'll come a little bit different level. And now we see the cord plexus and the ventricles of the baby's brain. Now the double line through here is the baby spine. We're going to come down that lengthwise. There's the upper back. And around the shoulders. We're going to come middle to lower spine. Towards the very end of the back. Nice and thin so we get pretty pictures off of you. We're also going to take and cross-section through this baby's spine. Think of it as a tube, and you cut a tube in half, we see a circle, kind of a triangle shape. We'll start with the neck here and work our way down the back. You can see the heart, so we know we're at the chest level. So this is the neck in a cross section, that circle. And then this is the thoracic spine in a cross section. We're going to continue down the back. baby's lumbar spine. Come down farther and we're going to be at the level of the pelvis here. So this is the lumbar in a cross section, and this is the sacrum, the lower spine. Again, we're going to stay in a cross section of the body, and we're going to, there's the heart, we're up in the chest area. So these images are going to show us that this baby's heart and its stomach are on the same side of the body and the correct side. That little dark circle there is the stomach organ. And you see that because they drink amniotic fluid. They practice. They drink the fluid, they breathe it into their lungs, and the kidneys make urine and they urinate that fluid. And the body is another way of checking how old this baby is. And measure its abdomen again. We come a little deeper into the belly and we'll pick up this baby's kidneys. So you see just a little gray structure here and one right here. Those are the kidneys. And we'll also look at them lengthwise here too. A little farther down, we're going to measure this baby's thigh. That will tell us its age. That's our last parameter. Just wiggling it there. Measure from hip to knee.
So its feet are down here.
The feet are up here.
Up here.
Yeah.
I always feel kicks right here on the left of my belly button.
Yeah. See, our feet are just right there. So there's a lower leg, ankle, and a foot. Crossed. This way to pick up that leg and a foot. Get that other one better. They cross and then they get on top of each other, and so you just have a hard time separating those tissues. This lower leg does. So here's like the lower thigh to the knee, lower leg, ankle, and foot there. Knee, lower leg, ankle, foot.
Yeah, the one on the right, I can see that really well.
Yeah, this foot is right there. That foot is here in front of that ankle, so it's harder to see. This little dark area here, this is the baby's bladder, and you see that because the kidneys work, so we should see that urine in the bladder there. And we're going to prove how many vessels are in the umbilical cord, and using a Doppler is an easy way of doing that. Just shows you movement. So you'll see like 2 lines right there. That's just what we want to see. That tells us that this baby has the correct number of vessels to its cord. Those are the two arteries right here. And that's what can be different are your arteries. The vein's always there, so you don't have to worry about it.
Mm.
Show the baby's kidneys lengthwise here. It just double checks us that we are seeing them in that crosswise view. Sorry if I'm hurting you, poking on you.
I just got a little seasick, but that's it.
So this structure right here, this is the left kidney lengthwise, and this is baby's right kidney lengthwise. I also like to show the diaphragm, the muscle that separates the lungs from the abdomen here. So you see just a little line here. That's the right diaphragm, and this is the left diaphragm. Pretty little faces. That's her moving. Nice little pictures. See her mouth open and lifting up that chin.
That's cute.
And there's an arm and a hand. You can see her little bicep there.
Stick after me.
Yeah, you can see her little bicep. Little gun show we got going there. Our arms. Fingers. That's her other little arm and hand right there. Oh, look at all those cute fingers there. Let's go back to heart. These are going to show the outflow tracts where the different arteries come off of the heart. So you see a little passageway just right here. That's the left ventricular outflow tract. That's where the aorta comes off the heart. Then we've got a passageway right here. That's the right side, and that's where the pulmonary artery comes off. We're also going to put some Doppler on that. And it just kind of helps the radiologists who are going to read these get that dimensional feel for them. You can see that one go in that direction. It just shows you the blood flow. That flashing is just movement.
Yeah, I felt the kick right then.
Yeah. So we've got this left side going this direction and the right side coming this direction, and that's what we want to see. They should cross each other, and this baby's does. Nice. More chambers. You can see valves opening and closing there. Placenta is along the back of this uterus, which is just fine. This thicker gray area here is placenta. It can be anywhere. We just look to see where it's at. And we'll look at the placenta coming across the uterus side to side.